Welcome to our channel. In today's video, we'll be discussing a crucial topic, first aid treatment for diabetes. Whether you're living with diabetes or caring for someone who is, knowing how to respond in an emergency can make all the difference. We'll cover the essentials of managing hypoglycemia and hyperglycemia, recognizing symptoms, and providing immediate care. Stay tuned, as this knowledge could one day save a life. Remember to like, subscribe, and hit the bell icon for more health and wellness tips. What is diabetes? Sometimes referred to as dextrose, blood sugar, or corn syrup, glucose is a form of simple sugar, also called a monosaccharide, a subcategory of carbohydrates. Think cereals like rice, wheat, potatoes, and many processed foods. Carbohydrates are one of the three macronutrients that are required to sustain life, the other three being fats like milk, butter or cooking oils, and proteins like meat or eggs. The body makes the glucose in these macronutrients available through the catabolic, breaking down, function of metabolism. In the human body and biology in general, glucose is the #1 fuel source, and its concentration in blood is primarily regulated by the insulin interaction. Insulin is an anabolic, building up, hormone secreted by beta cells in the pancreas in response to sensing high levels of blood sugar, speeding the uptake of glucose in the body's cells and bringing levels back down to normal. Diabetes is when this insulin interaction malfunctions and glucose isn't absorbed by the body's cells, resulting in abnormally high levels of glucose in the blood. Low blood sugar, hypoglycemia. When the body of a diabetic person experiences a lack of adequate blood sugar, also known as hypoglycemia, this can cause various symptoms, including feeling shaky, feeling dizzy, feeling confused, sweating, headaches, blurred vision. But if it's high blood sugar, hyperglycemia, the opposite is an excess of blood sugar, known as hyperglycemia, and it can cause symptoms like increased thirst, frequent urination, fatigue, blurred vision. First aid for diabetes emergencies. #1 Hypoglycemia first aid. Low blood sugar is not immediately life-threatening, but without treatment, a person's condition can quickly deteriorate. Follow these first aid tips to avert further complications. Help the person to lie down or sit in a comfortable position. To alleviate or prevent difficulty breathing, loosen any tight clothing. Give them a sugary drink or snack like fruit juice or candy. Double-check it's not a diet or no sugar product. Continually give them some kind of sugar every 15 minutes until they feel that they have recovered enough. Then follow up with any simple and readily available carbohydrates like fruits or if they become unresponsive or unable to swallow, it is time to stop providing them with food or drinks and call for emergency medical assistance. Secondly, hyperglycemia first aid. If someone is experiencing extremely high blood sugar levels, their life is not in immediate danger, but their condition needs to be alleviated and monitored. When hyperglycemia can get life-threatening is in a remote location when you may need to offer first aid. The most immediate course of action is to try to reduce blood glucose, which can be done by, for a diagnosed diabetic who understands their own condition and is well enough to do so, you may only need to provide assistance if they request it, so be sure to ask them first if they need help first. For someone who has not been diagnosed as diabetic but who checks off many of the boxes for risk factors and symptoms, they may need to seek further medical care. Ask them if they have their medication and if they need assistance administering it. Encourage them to drink plenty of water and supply them with it if they request it. Observe their condition and be ready to contact emergency services if it worsens. Diabetic coma. When DKA, HHS, or severe hypoglycemia deteriorates, the individual can be at risk of entering a diabetic coma. This can be rare because in most cases a diabetic person's family, friends, or caretakers will have identified the symptoms of the aforementioned complications before deterioration has progressed to this state. However, Diabetic comas do still happen, in which event it should be treated as an emergency because the individual's breathing may stop and this puts them at risk of brain damage due to lack of oxygen to the brain. Contact emergency services immediately. While waiting for help to arrive, try to keep the person calm and comfortable by placing them in the recovery position to minimize harm. You may be tempted to provide the person with a sugary drink or snack, but in a situation where the individual is lapsing in consciousness, they can lose control of their swallowing or coughing reflexes, making it hazardous to introduce fluids or solids to the throat. Only give a fully conscious person food or drink. Refrain from trying to administer any insulin, as this may not correctly address the cause. Remember that diabetic coma can come from multiple complications, and you may not be aware of which. Monitor the person's breathing and be ready to perform CPR if the person begins to have difficulty breathing. When emergency services arrive, they will be able to assess the diabetic individual's condition, but be ready to answer any questions they may have. Final thoughts. Managing diabetic levels through doctor-directed medication, diet, and exercise can help reduce the risk of complications and improve overall health for all types. However, severe complications and even diabetic coma can still occur, which is why it's important to understand the symptoms and the basic first aid that can help mitigate further harm to the individual. So, if you enjoyed this short video, please subscribe for more informative content. Thanks you for watching. Until next time.